Have you ever awakened in the morning, disoriented by the subtle slip of a memory, forgetting a crucial appointment, misplacing your keys, or pausing mid-sentence searching for a name? For millions across Europe, these tiny lapses echo a far deeper anxiety, the encroachment of cognitive decline and ultimately Alzheimer's disease. It is a fear that lingers in homes from Berlin to Milan to London, especially among those who have witnessed loved ones succumb to confusion, dependency, and loss of self. Dr. Lauren Pierce, a renowned clinical neuroscientist working across leading European memory clinics, recalls her first meeting with Mr. Peter Schreiber, an economist in Frankfurt. At 56, Peter built a reputation for analytical brilliance and meticulous project management. Yet, over several months, his colleagues noticed subtle mistakes. Peter forgot key figures during board meetings, missed deadlines, and struggled to navigate familiar city streets. His wife Ingrid became increasingly concerned. Peter, who used to remember every detail of their travels through Tuscany, now asked for directions home. At first, Peter rationalized these failures: stress from work, fatigue, aging. But the episodes became more frequent, affecting his professional standing and personal confidence. He withdrew from social events, became irritable, and feared admitting his difficulties. Recognizing the progression of symptoms, Ingrid persuaded Peter to visit Dr. Lauren Pierce's clinic in Munich. There, Dr. Pierce conducted a battery of neuropsychological tests: mini mental state examination, MMSE, Montreal Cognitive Assessment, MOCA, and advanced computerized memory tasks. She also ordered a brain MRI and blood biomarkers, including beta-amyloid and tau protein analysis, following the best practices recommended by Europe's leading dementia prevention programs. After thorough assessment, Peter was diagnosed with mild cognitive impairment, MCI, a clinical condition that sits at the crossroads between normal age-related forgetfulness and dementia. Dr. Pierce explained that MCI is not a sentence to dementia, but rather a warning light, a critical window for intervention. Peter's clinical case reflects hundreds studied in the EPAD, European Prevention of Alzheimer's Dementia Program, which has created clinical trial platforms throughout Europe, specializing in early identification and multifaceted intervention. Under Dr. Pierce's guidance, Peter began a multidisciplinary prevention program, integrating the most effective evidence-based medical therapies and lifestyle interventions. Firstly, Dr. Pierce ruled out reversible causes: vitamin B12 deficiency, hypothyroidism, and side effects of prescribed medications. She prescribed personalized cognitive rehabilitation, combining cognitive stimulation therapy, CST, computerized cognitive training, and memory strategy coaching. Secondly, Peter enrolled in the Generation S2 clinical trial supported by Novartis, where he received monitoring of experimental anti-amyloid agents under strict European Medicines Agency protocols. Although pharmaceuticals such as donepezil, rivastigmine, and galantamine, known as acetylcholinesterase inhibitors, had shown only modest symptomatic relief and high adverse event rates in MCI patients, Dr. Pierce emphasized research into disease-modifying agents and monoclonal antibodies like lecanemab as new hope for those at risk of progression. Thirdly, Peter followed a rigorous lifestyle intervention plan based on the FINGER study, the Finnish geriatric intervention study to prevent cognitive impairment and disability. Under European guidelines, he adopted a Mediterranean diet rich in omega-3 fatty acids, green leafy vegetables, whole grains, nuts, and berries. He joined a group-based aerobic exercise program, attended weekly social engagement clubs, and participated in mindfulness-based stress reduction, MBSR, sessions. Dr. Pierce programmatically tracked Peter's progress using digital cognitive assessments and annual brain imaging, collaborating closely with his primary care physician, a neurologist in Frankfurt, and nutritionists from the Barcelona Vita Brain Research Center. 6 months into the protocol, Peter's cognitive scores stabilized and his subjective memory complaints decreased. He regained confidence, resumed his leadership role, publicly attributing his recovery to early detection, personalized medicine, and ongoing support from Dr. Lauren Pierce's European Memory Clinic network. Peter's story is echoed by others. Anna Müller in Zurich, a retired teacher diagnosed with MCI after routine screening. Luca Romano in Milan, whose family history prompted genetic counseling and early intervention, and Sophia Bauer in Vienna, who joined a Mediterranean diet clinical trial after observing changes in her episodic memory. Dr. Lauren Pierce educates her audience on the science underlying these prevention strategies. MCI results from synaptic loss, vascular changes, and accumulation of neuropathological proteins, amyloid beta and phosphorylated tau. Pharmacological interventions focus on inhibiting acetylcholinesterase, targeting amyloid clearance, and modulating neuroinflammation. Non-pharmacological interventions, especially cognitive stimulation, exercise, and nutritional optimization, are proven to delay or even reverse early synaptic dysfunction, as supported by meta-analyses published by the European Task Force for Brain Health Services. For those wishing to follow in Peter's footsteps, Dr. Pierce offers detailed guidance. Schedule annual cognitive screenings at accredited memory clinics. Request biomarker analysis and neuroimaging if subjective memory concerns arise. Integrate daily cognitive training, puzzles, dual end-back memory tasks, language learning, or group-based cognitive stimulation therapy. Prioritize cardiovascular health. Control hypertension, diabetes, and hyperlipidemia. Maintain social connectivity. Participate in community workshops, volunteer programs, and intergenerational clubs. Adopt a Mediterranean-style diet, exercise regularly, and avoid smoking or excessive alcohol. Dr. Lauren Pierce's research network includes thousands of Europeans who have delayed progression from MCI to dementia. She shares anonymized success stories, clinical trial outcomes, and recommendations on her educational channel, inviting viewers to engage, share experiences, and contribute to ongoing research. Every action taken during this window, from lifestyle adjustments to clinical trial participation, represents hope for retaining autonomy, identity, and quality of life. Take this journey with Dr. Lauren Pierce's European team and become part of a growing community dedicated to memory health and prevention. Book your screening, start cognitive training, connect with others at risk, and help rewrite the future of cognitive aging in Europe. Remember, early detection saves lives, knowledge empowers change, and proactive care led by experts like Dr. Lauren Pierce delivers real results for patients and their families.